Good morning, everyone, and it's a pleasure to be here. And let me thank my brother and good friend Mohan for inviting me and asking me to join you and share some thoughts with you. Mohan and I go way back, fellow troublemaker. So it's indeed a privilege to be here with you and share some thoughts. What I think is central to how we address issue of social change and social transformation, and which is leadership. Typically, I talk about culture and focus on the work I've done in using a cultural model to address how we understand decisions people make about health, and why it's so important to focus on not just the negative, but the positive aspects of behavior. Because as we know, we tend to follow established theory of model as received wisdom, and without ever questioning the premise on which they are based. So my work is always about questioning the question. And that will cut across in what I have to share with you this morning on leadership. When we think about leadership, we typically think in terms of having vision, innovation. There are also these sort of terms used to describe what is expected in leadership, and as distinguished from management or administration, where the notion of keeping the train running on time. That leadership is more about deciding what sort of train is appropriate for which context, and what will be the design, and why, whether or not a train is actually needed, other mode of transportation may be more appropriate. But what is so central to leadership, or for me at least, is something that has been the theme of yesterday's conversation, the pre-conference, and that's this issue of ownership. The ownership is really one of these concepts that let me illustrate with a story. It's the best way for me to share with you what I think about ownership, and that is going to cut across what I will be talking about. It's the story of the snake and a toad. The snake that owned a horse. The snake was sitting on the saddle of a horse and riding along the path, galloping and looking so sloppy on the saddle. It wasn't really a pretty sight to see. The toad standing by and really observing this awkward looking, just there was no way of describing it. Got so exasperated and asked the snake, "What are you doing?" The snake said, "Well, I'm riding my horse." And he said, "Well, come down, let me show you how you ride a horse." So the snake slid down, and the toad got on the saddle, positioned itself so firmly, so effortless in the way you ride a horse, went around and rode the horse in such a beautiful, elegant manner that you want to learn how to ride a horse. So it came back to the snake and said, "Now that is how you ride a horse." And the snake said, "Thank you very much. Come down." The toad came down, slid back on the saddle with the same awkwardness that has been observed before, and before leaving, looked at the toad and said, "To know is good, but to own is better." What is the point of being a good horse rider when you don't own a horse? So what is the point of being a great farmer when you don't own a seed? What is the point of being a good scholar when you don't own the theory and ways of knowing that inform the ways that you are going to engage scholarship? So ownership is not about what is neat or pretty, it's how you are rooted in what you do. So that is what is going to cut across what I want to share with you. And in ownership, you can't help but recall history. And if you listen to what was discussed yesterday, there's a lot of way of trying to capture history in terms of how community engage in their lived experience and begin to engage in social transformation. There's a clear issue of identity in ownership. And I've said, and In previous presentation I shared at the School of Public Health, a popular expression that said no one should enter their home through somebody else's gate. And identity allows you to frame the gate through which you enter what you own, or notion of ownership. And then there's posterity. What are you leaving behind? And what does this really mean to own? So when we talk about social change, what does it mean to own in terms of thinking about social change? So I'm going to punctuate some of the things I say with some African expression. Sort of my guidepost. Anytime I'm making decision, I try to remind myself what is important. A sense of ownership, and my own ownership came from the way I grew up. That one who thinks he's leading and has no one following is only taking a walk. An army of sheep led by a lion can be defeated by an army of lions led by a sheep. Leadership is very important. A large chair does not make a king. So the structure and places sometimes that people fight and wrestle over has nothing to do with ownership. Because the ownership is not about the size of the space you occupy. It's the authenticity of the idea and the rootedness of your value and vision. But when we talk about leadership, sometimes we conflate it with what we are accustomed to in the academy and evaluating performance. Because we go through performance review. And I want to make some distinction between that which we engage in once you've done your work and you're giving feedback as to how good or bad you are, and what we tend to look for in leadership. Even though when we are looking for leader, we tend to look at those performance evaluation, and they don't necessarily align. So I'm going to talk about performance evaluation, going back to a US military record that really shows some language in which evaluations were conducted in those days. So for anyone who felt that you really had it bad, that your supervisor was very mean, use this really offensive, dismissive language to describe you. Let's take a look at this. For a list of the officers of this 27th Regiment of Infantry arranged agreeable to rank, and next year will find all observation I deem necessary to make. August 15, 1813. Respectfully, I am sorry, your obedient servant. Of course, we don't write that way anymore, but this is, I just pulled some actual record, a good-natured man. Let's say measure, a good man, but no officer. The captain, a man of whom all unite in speaking ill, a knave despised by all. An officer of capacity, but imprudent, and a man of most violent passion. And then there is all sorts of language that actually today will result in lawsuit because there were different identities that were considered not human, because today we talk about the whole issue, at least for me, the whole issue of blackness. But Irish at the time were the niggers of those days. Low vulgar men, with the exception of Perrin, Irish and from the meanest walks of life, possessing nothing of the character of officers or gentlemen. The very dregs of the earth, unfit for anything under heaven. God only knows how the poor thing got an appointment. These are actual ways that evaluation were conducted. Just so you don't think this were in the past, there are actually evaluation comment from actually federal record in the US in terms of how supervisors evaluate their staff. And these are actual quotes. I will not allow this employee to breathe. This employee is really not so much of a has-been, but more of a definite won't be. When she opens her mouth, it seems it is only to change feet. He will be out of his depth in a parking lot puddle. This young lady has delusions of adequacy. The employee should go far. The sooner he starts, the better. A gross ignoramus, 144 times worse than an ordinary ignoramus. a prime candidate for natural deselection. Gates are down, lights are flashing, but the train isn't coming. Has two brains, one is lost, the other is out looking for it. He sets his personal standard low and constantly fails to achieve them. He has a knack for making strangers immediately. When his IQ reaches 50, he should sell. It's sad to believe that he beat out 1 million other sperm. Takes him an hour to watch, an hour and a half to watch 60 minutes. Actual record for Federal Register. So in terms of evaluating performance, and of course we don't use this, we look at what has happened. But leadership, on the other hand, is about really trying to predict the future. You're trying to understand whether or not the individual coming into a position is able to anticipate what is to happen and position the unit to take advantage and be ahead of the curve. And so prediction is very much a part of how we're thinking of who will be a good leader. But prediction is so elusive. In fact, there is Ned Silver in the US who has been very good and praised for predicting not just election, sporting event, and wrote this book that talks about the challenge of prediction and the human factor that goes into why prediction is so challenging. So in the signal and the noise, there's a lot of noise, and the challenge is how do you weed out the noise to get at the signal, what really predicts. But so let's take a look at some prediction that we may have heard about, something that individuals predict and what the outcome is. It'll be years, not in my lifetime, before a woman will become prime minister. And that was Margaret Thatcher in 1969. I didn't know that she would become prime minister. Who the hell wants to hear actors talk? This is Harry Warner and Warner Brothers, and this was the days of silent movies. Because at the time, the notion that people were actually talking movie was so absurd that they didn't really think it would happen. Who said this? We don't like their sound and guitar music on the way out. Decca Record Company rejecting the Beatles in '62. I think there's a world market for about 5 computers. Watson, chairman of IBM. Doesn't matter what he does, he will never amount to anything. This is a guidance counselor talking to Einstein's father in terms of what Albert Einstein wasn't really doing or performing in school. So in terms of prediction, we really need to be very careful of how we make selection, what constitutes leadership. But what is of interest in the context of social change or social justice is how the notion of prediction is actually lost in how knowledge production is framed starting with training in school system. How what you learn in school disconnects you from the livelihood of your parents and family in such a way that you begin to see yourself and everything associated with your education better than whatever your parents had experienced. In fact, it led Ngugi wa Thiong'o to conclude that the child was now being exposed exclusively to a culture that was a product of a world external to himself. He was being made to stand outside himself, to look at himself. But actually, there's nothing wrong with standing outside yourself to look at yourself. The problem is when you stand outside yourself to condemn yourself. And that is really what the challenge is. Because in terms of social change, to stand outside yourself and embrace that which is outside of you and not critically analyze it or even condemn it. As you go to school, you condemn everything that your parents have ever been about. Or you go to school, you're taught to advance that the metrics for achievement is going to be measured by how far you distance yourself from who you are. And that is where, so in social change, the question is, what are we changing? And this comes about in even discussing the notion of resilience, which is really the term that came from metallurgy, the notion that an object will lose its shape and what happens when it's exposed to an extreme condition, and what happens when you remove it from that extreme condition. So in social change, what are we changing and what are we transforming? What was there before? And how rooted are we in what we own? So my work in leadership is really be framed around this notion of claiming your space. To claim your space. That your space has meaning. That because one is being conditioned to distance yourself from that which nurtures you, doesn't mean that you function outside of your space. To claim your space, and that is what the transformation discussion has been about. Let me again introduce some leadership quote before we get more into some further discussion of what that claiming your space means. Isn't mountain to climb that where you are is the pebble in your shoe. So in claiming your space, it is really not the overall transformation, it is the little everyday way of naturalizing what has become normal for you in rethinking, do theories really matter, and what is theory to start with, and what are these assumptions and factors that constitute what we understand as theory. I never cared about acceptance as much as I cared about respect. So the question of how do you affirm difference even as you embrace belonging? A local difference in a global belonging. And those are the things that we have to think about. You cannot shake hands with a clenched fist. And the notion of engaging in different ways, maybe the shaking of hands is not what you want to engage in at some point. The hand that gives is always on top. The relationship between donor and recipient. And the structure of that relationship is such that you should expect the outcome that we see, because the hand that gives is always on top. The hand that gave yesterday, Mohan framed the context of USAID and other organizations that give, that already frame what they expect to be an outcome for which you will be rewarded by getting more funds and more money. The hand that gave maybe Monsanto, in terms of the seed you are giving, it will result in some yield. The question is, do you own it? Or are you a tenant in your own home? And it may be very comforting because the lights are always on, the things are clean, but in the final analysis, you are a tenant and you don't own it. So the notion of claiming your space begins with questioning the question. And this is how I learned about Africa, the shape of Africa. If you walk into my office, this is what you see. So the question of what is normality, and why do we accept that the North is the North, the South is the South? Who positioned it? And can we flip it? Is this really a world upside down, or is it the normal? Is the way we understood it really a world upside down? You have to be able to question the question, not to necessarily say what is there is wrong, to say, does it allow me to own the way I produce knowledge? So learning about, our learning assumption about learning goes into what does theory and practice mean. And yesterday we heard about this corporatization of information. And we make a distinction between information and knowledge. Knowledge is when you act on information that you receive. A lot of the things that we get, you have information and we try to figure out a different way to pass on that information and claim it is knowledge. No, knowledge has not really taken place. In part because the space is not our own, and we're looking at products that have no relevance and is not rooted in our own reality. Is it communication or communicate? Because communication is not really about talking. There's a lot of listening that is involved in communication. A one-directional, so I think in a lot of ways communication has been conflated to mean communicate. You just tell people what they are really supposed to be doing and not really engaging in the art and science of listening. This focus of intentionality, how you really feel about an issue, as opposed to understanding how system structure what we consider to be acceptable or unacceptable. That it is not individual intention that is important, but it's the way the system structure what is in and what is out that matter. And this is why when we talk about social change, it's not always about, it's mostly not about whether people behave badly. It's whether structure condition the behavior in ways that it wouldn't matter who occupied that position or that office, the outcome will be the outcome. And so you have to look at the structure and the system, beginning with curriculum, when it's time to school, the training that we offer, the assumptions that we combine to form this theory that we teach and practice, and how theory and practice go hand in glove. And this is really what's been the foundation of the cultural model, the Pen 3 model, that some of you are familiar with. The idea that everyone has something positive about it, and you have to begin at that point. The idea that there are existential features, there are negative features, and this is not just about what individuals do, it's about the structure and system. And this is really a major part of what our journey is in social transformation. What is the role of culture? And the two books that some of you are familiar with, they are captured in the terms of leadership. So claim your space, but be prepared for some defeat. So part of what I'm sharing with you is less about what we need to do about the system, but more about how you need to think about the system and think of your position in relation to a system. And a defeat is something that we tend to shy away from, but it's a part of leadership. And you have to be positioned and prepared for it. You may encounter many defeat, but you must not be defeated. In fact, it may be necessary to encounter the defeat so you can know who you are and what you can rise from. It's Maya Angelou. Let me again introduce some additional African expressions. Moses do not make skillful sailors. What you help a child to love can be more important than what you help him to learn. One who causes others misfortune also teaches them wisdom. So is what happened to you is one thing, is how you interpret it is another. So social change is about how you take the events around us and turn it into possibility for social transformation. In fact, it's so engaging. A Native American expression, what is being considered the longest journey. The longest journey that you ever take is the journey between your head and your heart. And that your head is where the money is, your heart is where you are rooted. And this major disconnect between the resources that define your success based on the matrix we've established in the academy, and what you really believe is necessary, is important for transformation to occur, which is why engaging community is so central to not just knowledge production, but social change and social transformation. A lot of academics have become so accustomed to dancing around their head that the location of the heart is very difficult for them to find. So a part of that is also embracing your fear, and because the journey between the head and the heart also involves a journey of confronting fear. One is afraid to fail or afraid of what others are going to say about performance. So judgment is always about what will be said of me. If you're going through hell, hey, keep going. You gain strength, courage, and confidence by every experience in which you really stop to look fear in the face. You're able to say to yourself, I lived through this horror. I can take the next thing that comes along. You must do the thing you think you cannot do. Do the thing you think you cannot do. That's Eleanor Roosevelt. And that fear is a part of the process and journey of leadership. You have to engage in what you think you cannot do. And for those of you, if you follow the journey of Nelson Mandela, you start to hear the poem Invictus, which was a way of a constant reminder of what he knew he had to confront and deal with in understanding how you deal with fear. And usually in the group setting, I ask people to look at the last verse, and President Obama shared the last verse in his eulogy of Mandela. It matters not how straight the gate, how charged with punishment is cruel. I'm the master of my fate and the captain of my soul. This is ownership and rootedness. This is the snake that may ride the horse upwardly, but understand that knowing is good, but owning is better. It's what grants you and what keeps you rooted that is so important. But you claim the space is not enough. You have to own it. And to own your space is what we try to do in the framework that in partnership with the United Nations AIDS program, developing what we call the house to home framework on how you address HIV and AIDS. It's also what we try to do in a more recent work, looking at critical race theory applied to public health, that racism is one of the central issues that we have to deal with globally, and that failing to identify and name it doesn't mean it's going to go away, but it's like a poisonous mushroom that grows and gains secrecy in darkness. That you shine light on it, you are able to take it on. And this has a global presence. When University of Maryland School of Public Health took on this issue and developed a whole training program around the role of racism in public health and how we need to use critical race practice to address and challenge the issue of inequity in the work that we do with the community. So I get into now the logic that cut across the work that I do, that I apply in different, whether I'm talking about culture, whether I'm talking about communication health, issue of racism. There's a cultural logic. In fact, assumptions made which are framed in theory are all grounded in culture. That is so doesn't make it irrelevant or less global, but it's simply the reality. And I'll use the African expression to sort of capture what I mean by cultural logic. One that says, until the lion produced their own historians, the story of the hunt will glorify always the hunter. So this meeting is about producing historians who are going to work towards ownership, even though it may be as unattractive as a snake riding a horse. And if you don't produce those new historians, the social change issue would take the form of what Mohan described yesterday, the ways that social change has been deployed through this classical lens of what you are to do in the global south. So it would take a new way of thinking, new assumptions to address issue of social change. No one should enter their home through somebody else's gate. The question is, if you see your gate, will you recognize it? What will be the gate for you and your community? Every institution, every community has different gates through which they engage in social interaction. The rules of engagement are different in every context. And this is so central to how we understand leadership and what must be done to bring about the transformation we see in our community. The one that is probably the most important for me, it's become sort of a mantra in my work, is do you know who you are without what you do? The major stumbling block between what I said yesterday, this notion of town-gown relationship, academic and community, is that academic, for the most part, many do not know who they are without what they do. Because the title and is being so tied into identity that the level of personhood where you are able to talk about where you are rooted, what matters to you, becomes absent. And yet when you engage community, whether it's in projects where you are collecting data, or you are working with community with social change and social transformation, you are asking members of the community based on who they are. When you do not know who you are, how do you even understand what is being shared with you? So the question of, do you know who you are without what you do? Is it all about your title? When you stop doing that which you do and you retire, do you stop being somebody? But we hope that you don't wait to that point before you start asking those questions. And this is really at the core of why it is important that starting from the margin is important. You don't get stuck in the margin. You have to move. And this is what we've done in Pen 3 model, the UN's framework, the public health critical race praxis. The current president of American Public Health Association has basically declared that eliminating racism using public health framework is the mandate of our presidency for the next year. And this becomes a clear issue and central issue. And this is my journey, my new position at St. Louis University, where social justice is so central to what we do and how we frame it, that is broader than looking at the criminal justice system, but begin to look at what impact our action have in actual health and lived experience of people who are in the community. What's sort of the history that is led to this particular situation? St. Louis and Ferguson's been in the news, but before then there's been a number of, there's St. Louis and Ferguson in every country, in every location. We just have to, so every time you see some issue of social injustice, the question you have to ask is, how far am I from a similar situation in where I live, where I'm located? And this is where you have to think about leading. You must lead, you must lead, you must lead. And again, leadership for me is not about administration having a position in some organization. It is about taking that initiative to be a part of the transformation and leading. You must keep learning. Yesterday I learned about poetography. So you have to open yourself to possibility of trying to understand how different contexts and those with whom you share similar ideas are really thinking through what is important and how to bring about social transformation by using what we see in very powerful way to illustrate what we hear, and so that our conversation can be much more robust and much more powerful. Questioning the question, we heard about smart city, which tends to suggest that everything about technology is smart or something new is smart. Technology does not equal smart. In fact, there is a way that technology is very important. We cannot discount it. It's very, it has given us a lot. But it's also one that Silicon Valley workers that demanded that computer not be introduced in their children's school, because they know that there's a time and location where you expose individual to what is new. So we have to watch our language, be very careful in questioning the question. The notion of affirming dignity of cultural agents, and this is really where the journey of, a part of the journey of social transformation. I think I shared with Mo and Amber a story that brought this home to me. Is the former Surgeon General in the US, Regina Benjamin, that shared a story that she had a clinic, she still does, in which, where she practiced. And a patient called her on a Friday and said, "Doc, I'm really sick, my back is killing me, I don't know what to do, and I know I don't have an appointment." And after some conversation, question about what may be happening, she prescribed a medication and said, "Well, come next week, early next week, and see me." So weekend passed, and now Monday or Tuesday, she goes to her clinic, and she's seeing patient, walks into the examination room, sees this woman. Of course, she recognized her. The woman is hunched over the examination table, and she looked at her and said, Mrs. So-and-so, why are you still hunching over? Did you follow my instruction? I prescribed medication for you. So the woman said, yeah, doc, it's not that I did not follow your instruction. I don't get paid till Friday, and I wanted to wait till Friday before I filled the prescription. And Dr. Benjamin said, oh, I see. She left the examination room, goes out, gets the medication from a pharmacy close by, brings it to the woman and said, well, here, take this medication. And she takes it from her, sort of turned her back to Dr. Benjamin, and tears welling up in her eyes. And she stood, he said, at that moment, I just realized I have robbed her of her dignity. And so she quickly came up with a story that says, you know what actually happened? We have a piggy bank. I didn't use my money to buy this medication. We have a system where when in times of crisis like the emergency, we go and get the money and we buy for the patient. And this woman, first somewhat better, and she said, well, you know, you need to get some rest in the next few days. So the woman said, no, I have to be back at work tomorrow. She cleans in the school system because the children are returning back to school. Then we have to get our classroom clean and proper for our students to return. So here is the story. If we talk about this story in terms of the conventional framing of behavior, the story almost sounds like it's socioeconomic, right? That this woman did not have money to buy medication. So we can always class it, and you can see the paper now, socioeconomic status. The woman was given prescription, she just didn't have money to buy the medication. That is why we're having problem in this population. But that's actually not the story. And that is why social change becomes very important in terms of thinking of a new way, a new historians who are going to retell the story. The story is that the majority of physicians will not have the skill to observe and be able to relate that she has robbed the woman of her dignity. Because the moment that medication was given, many people will feel so good that they've been able to help somebody who they feel was needed some help. And that will be the story you go home and tell somebody, I helped somebody out today, maybe I used my money, it's so wonderful. But it's the ability to know that the woman was robbed of her dignity. Beyond that, you expand the narrative to say, what does this really tell? It's an indictment on our society. If we had universal health insurance, we wouldn't be having this conversation. The moment I call in the prescription, she would have had insurance to go and get the medication. So the issue of socioeconomic status being a factor to explain why people couldn't use care would not even factor in, it wouldn't be an issue. So the classical way of looking at story is to quickly put people in category of need, of poor. But the new way we are challenging people to do is to understand that it is more than that. People have dignity, and they are not defined by how much money they have or don't have, even though having resources is very important. But the question is, how has system failed the people in our community, where they have to, when they respond or make decisions, we are looking at buying power. And so cultural agents and the affirmation of our dignity is very important. It's a Nigerian public intellectual that used to write at High Solarin, the late High Solarin. He would write a column that says, Nigeria, may your road be rough. I wasn't wishing Nigeria ill. He was basically saying that smooth seas do not make skillful sailors. That if you haven't faced challenges, it's very unlikely that you are going to emerge as a consequential leader. that the best I can wish for you is to have difficulties and challenges in your journey. And that as a result of that challenge, that you don't quit, that you begin to think of different ways to embark on the journey and draw on the resources of those who are around you. So for me, to all of you, may your road be rough. And you must dream. It is important to dream and dream and dream. It's a calamity to die with dreams on fulfill. It isn't a calamity to die with dreams unfulfilled, but it's a calamity not to dream. The words of Benjamin Hill, the size of your dream must always exceed your current capacity to achieve them. If your dreams do not scare you, they are not big enough. And that's Solid Johnson, because if the dream of care does not scare you, then it must not be big enough. It has to be big enough that somebody has to be saying to you, you are crazy. All right. So critical social determinants of health is horizontal, and so is culture-centeredness in knowing. So it is how you challenge the vertical way of looking at program in an era of looking at transdisciplinary scholarship. And that is really what cultural centeredness is designed to do. And we have to be engaged in what V.Y. Mudibe is called epistemological vigilance, that older generation worry about political sovereignty and independence, that for a number of you is looking at epistemological vigilance where knowledge production is critiqued in ways that you can have a sense of ownership. The example is not accepting individual-based ways of knowing as the norm, as universal, and particularly in a collectivist environment. Owning the seed of consumption and knowledge production. Seed is not just in terms of agriculture, it's in terms of the foundation we lay on which you build your career and your future, and you have to own it. Cultural affirmation of one's rootedness in what is a difference, where a difference that makes difference, where you are proud of. That we have a global village doesn't mean you lose that which which define you in terms of the notion of being rooted and notion of being a part of a crowd in a way that you are not lost in the crowd. We can still see you and know that you are a part of, even though we know you are a part of the crowd. And I will end with this expression that sort of defines this challenge of the journey that we are on. We face neither east nor west. This was a time of political challenging in Africa, and when that desire to have different people come together to own their own space, claim their space, own their space, and it was said that we face neither east nor west, we face forward. We prefer self-governance with danger to servitude in tranquility. And this was Kwame Nkrumah. We face neither east nor west. So in leadership, my question is always, which direction do you face?